Good morning, everybody. Today is the last day of this CME, and our first session is on quick materia medica, where we have chosen S.K. Ghosh remedies. These remedies, in fact, have not been proved in any way. And Dr. S K Ghosh, who was a practitioner, qualified MD, converted homeopath, and was attending a large Calcutta municipal homeopathic hospital, big clientele, and he had some clinical experience which he has written in this book, and which seniors including Dr. S.P. have found very useful in their practice, and we also are using it. So I wanted to share this with you. These 7 remedies, in fact 7th is a 6th and 7th. So 7 remedies: Thyroidinum, Pituitrinum, Insulin, Lac-v-d, Variolenum, and Staphylococcin streptococcin. We shall take these remedies one by one. First, Thyroidinum. The drug picture of Thyroidinum. Now this drug picture centers around sphere of action, region, generalities, then the periods, infancy and childhood, adolescence, then allergy and vasomotor disturbance, respiratory manifestations, symptoms of female reproductive system centering around menstruation, pregnancy, labor, puerperium, and lactation, and finally skin and diabetes. We shall take them one by one. Sphere of action of thyroidinum centers around myxedema, that is shortage of thyroxine, where there is mental dullness, physical lethargy with sluggish reflexes, dry skin, and subcutaneous edema. These are the symptoms of hypothyroidism. Then BMR rise, the other side, thyrotoxicosis, increased consumption of oxygen, increased protein metabolism with higher excretion of urea and total nitrogen, profuse diuresis, urination due to increased urea, loss of weight from breakdown of fat, carbohydrate, and partly protein metabolism. Then toxic features associated with this are centering around circulation, nerves, and metabolism, that is neurocirculatory and metabolic. So this is the sphere of action of thyroid. Then region, toxic features. In toxic features on head, headache, weakness, and fine tremors of muscles, again a feature of thyrotoxicosis. Nervous temperament, dilatation of skin vessels and sweating, increased cardiac rate, tachycardia, sensitization of sympathetic nerve endings. Because of that, the patient is under stress and tension because there is excessive of sympathetic overtone. Then dynamically effective in cases which have background of deep and complex metabolic disturbance associated with functional, neurogenic, and cardiovascular imbalance. Function. Then its role in fever is something like this, that it is seldom effective in febrile conditions. We don't use it in febrile conditions except in very obstinate or obscure cases of fever where some vasomotor or metabolic factors are suspected behind rise of temperature. Apart from that, for routine temperatures, it is not used. Then we go to generalities. It's a chilly patient, largely, but benefits hot patients also. In which conditions? Where there are complex nervous disorders of functional nature. Then, so it suits thin-built persons with prominent eyes, nervous temperament, but not contraindicated in fat persons if general background agrees. Then, puffiness of face in chronic diseases, urticaria off and on, and sex abuse or sexual overindulgence as a causal factor. These are the generalities. Then we go to the stages, infancy and childhood. One of our best remedies for newborn babies. In case of convulsions not due to birth trauma, babies of mothers having eclampsia, that is toxemia of pregnancy, parents having nervous and metabolic disorders including diabetes mellitus, allergies. Then convulsions of children during dentition without fever. Aggravation from cold water. We know the modality of opium where hot water aggravates. Here it is cold water. Infantile vomiting and jaundice, icterus. Vomiting and nausea with chronic disease is a keynote. Nausea, vomiting associated with chronic disease is a keynote of thyroidism. Child seems to have swallowed amniotic fluid. As a result, complications or due to cranial injury. These cases seldom come to us directly professionally, but if someone in the family or known one, close one comes, then we get an opportunity to use these or some complicated cases where the case is not responding. Then a toxic vomiting from second or third day of delivery. Projectile or strenuous vomiting when stomach is empty. Projectile, forceful, and strenuous with lot of gagging. So both types of vomiting. And urine, this strenuous will become when stomach is empty. If there is nothing in the stomach, naturally there will be more of a gagging, more of a desire, but nothing will come out. So that will be strenuous. If stomach is full, it will be projectile. Urine scanty due to dehydration. Then icterus of grave intensity along with vomiting. So in cases of jaundice where you have no indications of other remedies. Then after that we go to adolescence, which is a very great field of thyroidism. Nervous disturbance during adolescence. Mental irritability, whimsical mood, hysterical tendencies. Then vasomotor disturbances such as vertigo, chronic headache, then convulsions, then flushing of face, and here use 200 or higher potency. Then we go to allergy and vasomotor disturbance. In allergic conjunctivitis with great itching and exudation during change of season or with vasomotor troubles, then itching in rectum or other mucous orifices is a pointer, keynote. Then vasomotor manifestations, vertigo, headache, nausea, weakness, paralysis also, pains in various descriptions. Then during every change of weather, not connected with severe organic disorders, that is functional. Functional non-inflammatory epigastric pain. Use 30th here. History of allergy or worse from change of weather. Then mental trouble from mild hysterical manifestations to severe insanity. Then when family history shows allergic background. So this in this light you have to prescribe this in allergic as well as other vasomotor disturbances. Then we go to respiratory manifestations where it is divided into two. I have divided it into upper respiratory, lower respiratory. So upper respiratory is rhinitis with excessive sneezing from edema of nasal mucosa. That is the cause behind rhinitis. Comes suddenly, passes off in a short time. So allergy, quickly sneezing comes and goes. During every change of weather, aggravated by cold and in cases associated with nasal obstruction. So you find a very common picture. Very many cases where you are not able to find the remedy, in spite of giving best remedy, not getting response. Try thyroidism here. Lower respiratory conditions are dyspnea without bronchitis and fever, then dyspnea as we get in allergic edema of lungs. Then in chronic cases or acute exacerbations of chronic conditions. Then in allergic asthma with severe dyspnea. Now we go to the female symptoms. Menstruation, functional or organic troubles also accompanying menstrual cycle. Symptoms aggravate with each cycle. Insanity connected with disordered menstruation in young girls. Then regulates flow in endocrinal imbalance when hormones alone are only palliating. You give the hormones, periods are normal. Stop the hormone, again the trouble comes. Irregular and scanty menstruation in young girls, cases of menorrhagia and metrorrhagia. Because this thyroid, there is an axis, no? HPA, that is hypothalamus, pituitary, A adrenal, and after that it is gonads. In between there is HPTA, there is thyroid. So thyroid controls the organs below, that is adrenal as well as gonads. So thyroxine has got a great role over gonads, over the action of the female ovary as well as the uterus. For that matter, irregular scanty menstruation, cases of menorrhagia, metrorrhagia, as I have already said, then gushing excessive flow when indicated remedies fail. Then vasomotor and nervous disturbance during onset or in mid-cycle. Either it is at the beginning of the menstruation or in between. It's a near specific for amenorrhea or scanty menstruation due to complex endocrinal imbalance, and S K Ghosh has recommended 3x potency here. And now whether you use 3x or you use 30 or 6, it is a different matter because potentized medicine is going to act. But then this is a good pointer and it really works in many cases. Then pregnancy. Controls vomiting during pregnancy well. Now vomiting means excessive vomiting. Vomiting is a normal thing, but when we talk of hyperemesis gravidarum, it is excessive. But in very obstinate cases of hyperemesis gravidarum, remember Lac-v-d defloratum. Lac-v-d defloratum is a routine remedy in cases of hyperemesis gravidarum. There are many medicines as per the symptomatology. Early abortion and tendency to premature labor, where thyroid 30 repeated doses from early months prevents abortion in third month. Then complications arising out of defective maternal metabolism and glandular maladjustments to maintain fetal growth. History of repeated abortion and premature delivery is a constitutional indication of thyroidinum. So that will be useful even in the history for complaints coming afterwards, when in past obstetrical history you find this. Then obscure cases of endometritis causing sterility, abortion, history of menorrhagia, pain during menstruation. Then we have here toxemia of pregnancy, in short TOP. This toxemia of pregnancy is a condition which is one-to-one associated with thyroidism, very commonly used remedy here for those who are using it. Symptoms here will be vomiting, vertigo, palpitation, dyspnea, edema legs. These are the common symptoms. So toxemia basically has three symptoms. One is albuminuria, second is edema legs, and third is hypertension. If any two of these three are present, it is toxemia of pregnancy, pre-toxemia of pregnancy. So hydramnios and various cutaneous manifestations. If the amniotic fluid increases, then because of that, whatever complications are covered up by this remedy also. Various skin manifestations with itching here and there, and especially itching around anus. Now, as you talk of itching around anus, immediately two drugs come to our mind. One is sulfur and second is teucrium marum verum. TMV. Teucrium marum verum also has that disturbing itching of anus, which is psoriatic symptom. Then control the diet, withhold salt if BP is high or urine shows albumin. This is a routine management which naturally you have to follow. You cannot ignore that. Variolenum 30 or higher, a few doses can prevent eclampsia. Then after pregnancy, we go to labor, puerperium and lactation. involution, that is regression of uterus to normal size, does not take place properly. Because of that, in the puerperium there is irregular bleeding, off and on, profuse or small, but lingers unduly long. Then puerperial insanity, when indicated remedies fail. Then in chronic puerperal diarrhea of mothers with anemia, edema of legs, general anasarca, with various vasomotor disturbance or symptoms of metabolic disorder, thin, emaciated and anemic subjects, but with edema and edema of extremities and face. So this is because of anemia. This is because of diarrhea. So if the diarrhea is controlled, these things are taken care of. Excessive appetite, voracious appetite, sometimes want of appetite, hyper and hypo. Then stools watery with no particular time of aggravation, offensive but not like surrender. Supply of milk when hampered by irregular hemorrhage. Because of irregular hemorrhage, the lactation is affected. So here thyroidinum. Finally, the last two are skin and diabetes. In skin, it centers around urticaria and angioneurotic edema, almost specific for both. Vasomotor imbalance in allergy. More the edema, larger the area, better it is indicated. Itching more prominent than burning, better by heat or in hot weather. In excessive edema, even without this modality, it is effective in 30 potency, but when proper symptoms are present, give higher potency, 200 potency. Then history of urticaria in angioneurotic edema, and where difficult to select medicine or when indicated remedies don't act in allergic patients. Here we go next to eczema. We see here indicated on basis of general background and character of local manifestations. That is not the totality. Recurrent vasodilatation with edema, redness, heat of part, itching of rectum, nose, eyes, etc. with or without exudation of eruption. Then history of asthma in family or self. Here there is history. History of allergy from any food. Withhold it from diet. If there is a history of allergy, then don't take it naturally, needless to say. In allergic eczema of children affecting head, face and extremities. For good results, advise to stop cow's milk and replace it by fruit juice or other milk, goat milk, etc. or melted milk or cereal milk nowadays they are using. Then finally, the diabetes. Important remedy for diabetes mellitus. Symptoms appear with great rapidity, extreme weakness, history of allergy in either the patient or in family. When diabetes appears after sudden self or forced cessation of allergic manifestation, either by medicine or automatically, if disease like asthma suddenly disappears. Then severe mental strain from long time ending in symptoms of diabetes. So drugs like acid phos, acid picric, silicea and tuberculinum also are remembered here. Diabetics with family history of some chronic malady and used as a reactive remedy in high potencies, prefers chilly patients, may be repeated off and on is in cases of diabetes. So this is a short, comprehensive and very useful picture in day-to-day practice for thyroidinum. The other remedies are short ones. We will take them one by one. Pituitary. Pituitary picture centers around two aspects. One is active principles, the physiological base or pharmacological base, and then dynamic indications. Here, active principles, it has got two important active principles. Pituitary. One is vasopressin, which causes constriction of smooth muscles of arterioles, intestines and bronchioles. Also acts as an antidiuretic hormone, ADH, causing, if its deficiency is there, excessive urination. Then oxytocin stimulates uterine contraction and tone. So these are the basic active principles on the basis of which dynamic action he has tried to explain. Now, dynamic action indications or action centers around four aspects. One is cardiovascular, second is female reproductive, then gastrointestinal, and summary of these three. Basing on physiological action, useful in 30 potency in anginal attacks with coronary spasms. In heart attacks of old people, naturally the patient is not going to depend on this, but it will be like a help. There are patients who need, in spite of all medications, they are not getting the results. So they want some harmless remedies. In heart attacks of old people, were hardly possible to pick up a well-indicated remedy. Specific action on anginal attack in chronic kidney diseases or allergic subjects. Precordial heaviness and pain from gastrointestinal disorders, acidity, wind formation, etc. There are many patients who come with this, but here they are not relieved by pituitary. Don't use pituitary in these conditions when associated with gastrointestinal trouble. Then cases of neuralgias of allergic origin, ovarian neuralgia, especially left-sided in patients with dysmenorrhea having increased flow, not indicated in pain with metrorrhagia. Then female reproductive symptoms are, it's wonderful in delayed puberty with defective development of breasts. Now that very axis HPATG. So here this pituitary is above thyroid. So naturally it has got a greater control. Then stimulating effect on estrogen in dynamic plane. In delayed puberty acts more promptly than crude estrogen, being antagonistic to corpus luteum. Its action is opposite corpus luteum. It is best, its action is best on gravid uterus, and when corpus luteum degenerates during late months of pregnancy, its action, its role begins. It is helpful in some cases of sterility and early abortion. Then we go to gastrointestinal. Regulates peristaltic movements of intestines. So because of that, because of poor peristalsis, there can be constipation, there can be symptoms associated with colics, etc. Useful in intestinal colic. Pain is griping from moderate to very severe. Nux vomica, colocin also are indicated. So in such cases, relieves flatulence and colic like carbovigen, mentha piperita, peppermint. Then intermittent severe griping pain when patient passes semi-solid stool with incarcerated, that is blocked wind in allergic conditions. Because of poor peristalsis, the continuous, that is the intestinal obstruction like symptoms are produced. And because of that, there is pain. So over there, pituitary in 30 acts like a very magic. I have practically used it in quite a few conditions. In volvulus and intersusception, these are surgical conditions normally, where due to some intestinal blockage, there is a turning around of intestines. There is intersusception, that is a surgical disease normally, where there is severe pain, and with severe pain there is bradycardia, pulse is low. Will avoid surgical interference in many cases. Try before going to surgery. If due to certain conditions surgery is not advised and patient is required to wait, then over there we can try it. Then in gastrointestinal, strangulated hernia in old people, restlessness because of that, severe griping, aching pain. It is a painkiller. In short, you can remember a homeopathic painkiller. Severe griping or aching pain with history of asthma or allergy in family or in oneself. Then severe spasm of gallbladder with a non-functional gallbladder. Nice relieving effect in cases of renal colic. In colic cases of severe intensity, patient tosses about in agony. Now here, Ghosh says, difficult to get a true picture of pain. So what happens? Great uncertainty prevails which medicine to select. Many try 2 or 3 remedies, and some of them give one after another. You try this, after this you try that, after this you try that. Better to try pitut in such cases, when with wider scope of action as an antispasmodic affecting smooth muscles, because its action, first active principle we have seen, action on smooth muscle. And bradycardia is a concomitant feature because bradycardia is also a feature of visceral involvement. If there is a visceral involvement, then the pulse will become slow. Then we go to the summary. Same three things summarized for hemorrhage. It's a repetition, but it is worth repeating. Due to antispasmodic property, this pituitarium is useful in coronary spasm of old people with shooting pain and great precordial heaviness on slightest exertion. Then irregular peristalsis in chronic colitis, spasm of anus and rectum in asthmatic patients, spasm of volvulus, intussusception, intestinal obstruction from other causes in old people and children. Then strangulated hernia of old people, particularly in asthmatic patients with intense griping pain. Also, in many cases, when indicated remedies fail, some cases of cholecystitis and urolithiasis, that is, kidney and gallbladder stones. When indicated remedies fail, obstinate cases of spasmodic dysmenorrhea acts on uterus and mammary glands by stimulating estrogen and corpus luteum. Delayed puberty, stunted growth with amenorrhea, atrophy of breasts due to endocrine imbalance, then regulates action of corpus luteum in sterile women with defective development of breasts, amenorrhea, and favors conception. So this is the picture of pituitarium. Next drug is insulin. Insulin action is centering around two. One is liver and metabolism, and on the basis of that, actually the second heading covers other therapeutic hints. Liver and metabolism of great utility in glycogenic imbalance of liver. Now here hepatitis and hepatic enlargement from continued toxicity. Liver enlarged after acute infections as typhoid, pneumonia, etc. Few doses of insulin 30 restore imbalance or restore balance and enhance rapid regeneration. Then action of insulin resolves around what? One is asthenia, weakness. Second is enlargement or chronic functional derangement of liver. Then chronic diarrhea in children with weakness and enlarged liver, greenish diarrhea with acute dysentery after acute dysentery, marasmus and infantile liver, which is called Indian childhood cirrhosis (ICC), chronic intestinal troubles with enlargement of liver, then suppuration indirectly related sugar metabolism. Suppuration is indirectly related to sugar metabolism. So as a result, any injury, any trauma is there, it leads to pus formation. Then tendency to abscess formation and easy suppuration again during close of acute infections or a sequel to acute infection and acute infectious disease with liver trouble. So involvement of liver is the keynote here in insulin because insulin is associated organ of liver, that is pancreas. So that is the way to remember it, no? Then therapeutic hints: chronic intestinal disorder with looseness of bowels and enlarged liver. The more the chronic diarrhea, it is more indicated. Then ulcers, boils, bed sores, hypopion is first formation in anterior chamber of eye. Then as after effects of acute infectious disease with distorted liver. Then chronic otorrhea. In fact, this is the background of SORA also. So here SORA, from soric angle you are prescribing, here it is being prescribed from a therapeutic angle, that is derivative. So it is worth trying in practice. Then chronic otorrhea and mastoiditis in emaciated children where the pus is thin, especially when combined with enlarged liver, chronic diarrhea, or after effects of some infectious diseases. Then intractable, that is difficult, eczema in patients with chronic liver troubles, a great reactive remedy in allergic eczema. Suppuration of scrofulous glands in neck, that is cervical adenopathy. Then best to use 30th pregnancy. Then we go to next remedy, that is Lac-v-d defloratum. Lac-v-d defloratum field centers around pregnancy, diabetes and modalities. Lac-v-d defloratum is nothing but cow's milk. So this is nowadays there is a medicine added like humanicum, that is human milk. So they are using it particularly in UK. Our friends from UK had said that this is more effective. We are also trying like humanicum also, but then Lac-v-d defloratum is what S.K. Ghosh describes. GI complaints of two categories: chronic dyspeptics, acidity from before, developed as complications in pregnancy. Now, first condition here is chronic dyspeptics in which acidity is occurring from before. So that is not Lac-v-d defloratum alone. It is centering around developed as complications of pregnancy. Here we use Lac-v-d defloratum. Then toxemic headache and neuralgia with acidity and constipation, profuse frequent urination during pain, going to urine again and again. Then in hyperemesis gravidarum, we have already discussed it in earlier remedy. Then vomiting, excessive with or without acidity, and almost as specific when indicated remedies fail. Then gallbladder and renal colic, various types of abdominal colic connected with pregnancy. Indications are constipation, acidity and polyuria during pain. Renal colic when calculi due to faulty metabolism during pregnancy. Then fermentative gases, acidity and constipation, or sometimes dyspeptic soft stools associated with colic pain, and pains of rheumatic and gouty nature during pregnancy or gestation. Then after pregnancy we go to diabetes. Particularly for some complications of diabetes, this medicine comes into play. Patient is emaciated and weak, asthenic type with glycosuria, then neuritis and pain, and with pain and asthenia as complications of diabetes. So three things here. One is excessive weakness, which is associated with glycosuria, and second is neuritis with pain, nerve pains. Then modalities here. Sick menstrual headache is a marked symptom. Headache during menstruation. Then acts best in chilly patients, very simple to remember, with susceptibility to cold. And in diabetes and various menstrual irregularities, if there is this modality of being chilly, then this medicine Lac-v-d defloratum is quite useful, keynote. Then we go to Variolenum, a very short remedy. This Variolenum is nothing but from smallpox, variola. So variola is smallpox. Burnett has used it as antipsychotic in tumor cases. Uterine hemorrhage, if there is fibroid, if there is a tumor there, maybe malignant, maybe non-malignant. Here uterine hemorrhage due to fibroid and other tumors of uterus, including cancer. Now naturally cancer will not be cured here, but here the bleeding will be controlled. That is the difference, no? Where backache is very prominent. In variolenum, most important thing is backache as a concomitant symptom. Then iridocyclitis and circumcorneal congestion of eye, involvement of the muscle of iris. Then because of that severe pain in eyeball and around the orbit, whole orbit is painful. Acute infectious diseases such as typhoid, influenza, then gastroenteritis. This influenza is nothing but today's what you call H1N1. So that is the viral diseases. So gastroenteritis, dysentery. During spring, when dry and moist atmospheric conditions rapidly alternate. The spring season is the special season where these diseases occur and action of this medicine. Throat pains with rheumatic fever, influenza with pain in body during spring season. February, January, February, that is the month which is spring season, Basant. Then pain in throat is an important indication in any acute infectious disease for variolenum, particularly occurring in spring. Pain in back is second associated concomitant important feature of variolenum. Finally, the staphylococci and streptococci. So from them, streptococcin and staphylococcin. It's therapeutic, simple therapeutics. Both are similar with little difference in action. Streptococcus suits more, or streptococcin suits more for acute diseases, acute cases, and staphylococcin for subacute and chronic cases. Blood dysentery of bacillary type, very troublesome complaint with excessive hemorrhage and toxemia, with high temperature. The more the blood, more indicated, like mercurius, mercor. Then, but no tenesmus or urinary complications like mercurius here in streptococcin. Acute cases during dry summer. Over there, variolenum it was spring. Here it is dry summer, maybe April, May, that period. Then staphylo is more suited to acute and chronic cases of dysentery. Though staphylo is more suited to chronic cases in general and strepto to acute. But here staphylo is more suitable to dysentery cases. Both types of dysentery cases. Maybe acute, maybe chronic cases with blood and pus. Ailments occurring during rainy season. Normally dysentery occurs more during rainy season. A dose of 200 can change the character of stool to yellowish or greenish liquid motion. That's a wonderful improvement. Once the action of the medicine is there, the blood stops. And once the blood stops, then that is a sure sign of the action, free from pus or blood. Give a dose of antisoric afterwards to complete cure. Then useful as isopathic remedies, both of them, in acute streptococcal or staphylococcal infections. For acute staphylococcal infections like boil, etc., this medicine is useful. And for streptococcal infections, this is streptococcin. Then that completes our description of S K Ghosh remedies. If there are any questions, you can ask.